I haven't slept much, and I should catch up sometimes during the day, but I thought, let's take the best advantage of my time instead of just, I don't know, watch a movie or something. I have it, in Italy it's really early, but I have been up the whole night. So unfortunately, but I have been listening to these videos in which Christopher Cole, this executive from the FDA, has been recorded by some reporters from Project Veritas about the vaccines and the strategy about the vaccines. And I thought it was important to point to some reading keys for this piece of news that we are all going to read in the newspapers these days. Now, we can be either very distracted or very careful in reading this news. And I thought that this piece of news is really interesting as a confirmation of things we should already know. But again, the public square has been very distracted, to say the least, about the vaccine strategy. So what are the key reading points about this news? Well, first of all, it emerges that there is a strategy about the emergency authorizations. Now, because Cole basically is saying that he already knows that they're going to approve the vaccines also for really young kids from 6 months on, and also that is going to be an annual vaccination process. So this is, he knows this because this is what they want. He says that the FDA is receiving hundreds of millions of dollars every year to push for the approval of these drugs, and the Biden presidency wants everybody to get vaccinated. Now, think about it. This is something we are talking about: emergency authorizations of drugs that have been called vaccines as a marketing strategy, because until 2021, these drugs couldn't have been defined as vaccines, but vaccine is a very successful term in the market to give the idea, the semantic of the vaccine is something that people know that is good for you. And remember, keep in mind, vaccine is a drug for healthy people, not for the sick. So it's the greatest dream of the big pharma, and we know this. I mean, since the CEO of Merck clearly stated this years ago, right? The dream of big pharma is to have every healthy people to have drugs cyclically, regularly, possibly, as if they were candies. And of course, I mean, with the term vaccine, you already achieved this dream somehow, you make it true. Why? Because the vaccine is a drug for healthy people. And it can even be made mandatory. So it's a double dream, right? So if drugs could be approved that involve healthy people, all of them in the whole world, to take them cyclically, regularly, yearly, this would be an amazing dream coming true for big pharma, having a perfect business, multi-billion, I mean, really big business coming through. And Cole says this. I mean, this is what they want. This is why they give money to the FDA. So, as I try to explain in my books, especially in The Death of the Phronimos, Faith and Truth of the Anti-COVID Vaccines, which I truly recommend you to read, because it's a book in which I try to explain how to read correctly the news about these things, how to have a science, which is a legal science and a moral science, to understand how to trust the news and to trust the processes of these things. And it's really important. I mean, the debate we've been witnessing in the last couple of years shows that people need this science more than any other right now to be able to think correctly, critically about events and facts and news. But so Cole clearly states this. He knows already. The journalist asks him, how can you be sure? I mean, still, we don't have data enough for example, to give these vaccines to young kids, right? He says, well, sure, but, with these emergency authorizations, we can do that. I mean, of course, I'm saying more than what he said, but you need to watch this interview. It's really revealing. But the point is that we can do this with very limited, lacking data, because this is what the emergency authorization is about. Keep in mind, the emergency authorization is something that you have when you have a real emergency, such that you are willing to give up the usual safety protocol of drugs, which takes on average 5 years of observation, statistical observation, what might happen to the human body when you put some new things, new drugs into it. It's statistics, so there's no way to predict, save probably a very little part of what you can actually envision, knowing how some chemicals work, right? But mostly in the case of drugs, it's about statistical observation. So it needs time, of course. And it needs numbers. I mean, enough people involved to be observed in the observation, right? So when you have too little people and you don't have enough time, like in the case of these vaccines, I mean, the emergency authorization have been given after an average of 2 months of observational studies on volunteers, right, during the trials. So, but in the case of the emergency authorizations, there is such a big emergency that since this drug promises a huge efficacy, able to overcome the emergency, you give up safety protocols, right? But you need and you are able to use limited data that shouldn't be enough. They shouldn't be enough in the ordinary process. Now, if you use the strategy of, in a sense, the emergency authorization is a dream coming true for Big Pharma as well, right? Because they can have drugs approved and put in the market with very limited effort and data, right? So it's an easy business in a sense. But now we know we could predict that, given the conflict of interest that now the system allows in agencies like the FDA or EMA in Europe, this can be predicted, right? That the strategy is that of just putting easily into the market drugs to favor the business of Big Pharma, right? We know that, right? But now we have a proof, evidence, scientific experiment, right? Cole is like having a lab experiment of what we already know. This is a key reading point of this piece of news, right? So the point is that for Big Pharma and politics, the emergency use authorization is a strategy not to fight the pandemics, but to have something they really want happen easily with the favor of public opinion. They want drugs for healthy people, all of them in the whole world, cyclically given, regularly given, even made mandatory. That's why Cole knows what's going to happen. They are canceling meetings these days, of course. Now this is a big scandal coming, right? But it's important for us to be able to read correctly this piece of news. So we have a strategy about the emergency use authorization. It is a key reading point. The other one is the conflict of interest and the real goal, objective of this, which is the annual use of drugs for healthy people. Now we have a technique too. The third point I want to stress is the technique. The technique is that of breaking the safety protocols and being able to use less accurate data, limited data. So when you can do something like this, you can predict, you can have your timeline for drugs. You know, for example, that in a few months, you will be able to use the drug also for other groups of people because this limited data is not such a big deal. In my books, I show also that in some cases they use studies with just 200 people, 300 people. I mean, for teenagers, they really use 1,000 people who received vaccine first. It's nothing. You cannot have real statistics on this. It's obvious, but there is the emergency, right? So with the emergency strategy, you can do whatever you want. Who cares about safety, right? When all these millions, billions are at stake. You know, in this science, the science of legal science, ethical science, you can predict what's going to happen when you give too much power, decision power, to people who handle too much money. This is called conflict of interest. This is why we pass laws about this. So it's predictable. This is real science. What Cole is giving us is the proof of what we already know. That's why this is a very serious issue. It calls for reforming the system, impeding this conflict of interest. Now, we already know something different too. He says that human experimentation, I mean, it's a proof of human experimentation. What Cole is saying is also that, for example, in the case of pregnant women, there were no data. Of course, we know that. I mean, I wrote about it and everybody knows, right? I mean, they were not involved in the pre-authorization studies and trials. So clearly, when you give this drug to pregnant women after you put them in the market with the emergency authorization procedure, you start a human experimentation without having to tell people about it. Well, you should tell them that there is an emergency use authorization, but people didn't care much. Journalists, mainstream journalists, politicians, they just, were celebrating about having the drug, right, available. But truly, you have a human experimentation, and he says that. I mean, we didn't have data, but now we use that. And he also says something really disturbing, that he says that it's very difficult to find volunteers as pregnant women during experiments, because not many pregnant women are willing to be lab rats, right? So, but now they did, right? Because he says now we do, because we are using the drugs. Well, what we know now is that adverse effects are really emerging in a very serious way. So there is an alert on this. In Europe, EMA stopped a lot the push for vaccinating pregnant women, but we knew that already, right? There was no data. This is human experimentation. Now, so what we know from Cole's, for sure, as an evidence from Cole's interview, is that the emergency use authorization has been used also to allow for human experiments with new drugs in a way that shouldn't be allowed ethically and legally after Nuremberg, after what the Nazis did, right? But this is it's a collateral, but it's an advantage from the viewpoint of big pharma and politics. You can have volunteers who are not volunteers, right? So you can have them. Now these things should be really focused on. We cannot let this pass through our windows like a piece of news among the others. This is a very important piece of news. We should focus on it, we should reflect on it. And also from my viewpoint of ethical science, we need to understand this. Ethical science, as I like to tell my students, is a true science that involves predictivity, ability to predict the future. The real science is the one in which you can demonstrate correctly something from premises to conclusions so that you can predict what's going to happen in the future. Ethics is extremely predictable. In this case, much more than vaccines efficacy or the weather prediction. In ethics, really, when you understand correctly human behavior, human needs, and goods, you can predict what's going to happen when you create the situation for people to act in a certain way. If you allow for a conflict of interest context, You know what's going to happen if there are billions at stake. You know that politics wants money from the industry. The industry wants politics to do favors to them. I'll give an example. If you in ethics start ignoring your wife for a few days, you know what's going to happen. You can predict what's going to happen. If you treat your friend as a tool, for example, because he has a car and can give you a ride, and you just use him as a tool for too long, you know what's going to happen to that friendship. Ethics is scientific and predictable. That's why legal systems have passes laws to avoid some situations which can be very dangerous. And this is what we should take from calls, let's say interviews. I mean, it's a secretly recorded situation, statements. So all the more reasons we should take it seriously. Apparently he didn't know he was recorded, so he was sincere. There is no reason to doubt about what he said. So let's read it correctly. Let's make other friends know about this, and spread the word. This is a very important piece of news.